How many premature infants are born each year worldwide? Can you say that?
Well, we can estimate it, and based on the best estimates that we have, about 15 million children are born premature. That is less than 37 weeks of gestation.
And this is 10% of the overall infants?
A little over 10%, about 11%, yes.
Is there a difference between developed and developing countries?
There is a difference between developed and developing countries. So you see the highest rates in sub-Saharan Africa and South Asia, and the lowest rates actually in some of the Scandinavian, Northern European countries. But the variation is not quite as large as what we might expect from other measures of health status. So small for gestational age, for example, has much wider variation than preterm does.
Why is Scandinavia so good?
Well, that's a great question. Probably because they have low underlying risk of spontaneous preterm birth, and they're very effective managers of medical intervention for early delivery. That is, they do not encourage earlier scheduled caesarean sections like other places in the world do.
There are some local habits that babies have to be born at a certain time, that they have to be born on a certain day of the week. This is all bad, yeah?
Yeah, this is...
Caesarean section, this is not good.
No, for convenience, caesarean section is probably inappropriate in the vast majority of cases. Obviously, caesarean section is an important tool to prevent death in both the mother and serious consequences of the infant as well. For example, in obstructed labor or in situations where the woman may be preeclamptic, and to manage the preeclampsia for the woman and the consequences for the infant, the child has to be delivered early.
For the future, does science agree how to bring down the premature rate?
We know how to bring down the medically induced early delivery rate quite a bit, because we have good experience of that in a number of developed countries. Probably the most dramatic changes that we've seen over the last 30 years are in the United States, where we saw a huge increase from the early 1980s up to the kind of mid-2000s, and then every year since there's been a decline in preterm birth, primarily because of a refusal of obstetricians now to deliver babies preterm based on convenience alone.
Preterms have a higher risk of morbidity and mortality. How much higher is the risk? Can you give an estimate?
Well, certainly preterms are in the, it depends on where you are in the world, but on average probably about a 3.5-fold excess risk of mortality compared to term infants around the world. So it's quite significant, and the morbidity and serious disability consequences are also quite significant for premature birth.
So prevention really matters. Thank you very much.
Thank you.